Well, we heard that Alberta has the highest number of measles cases per capita in North America. I mean, how do you react to that? Why is this province the hardest hit right now?
Well, I mean, this is just an appalling situation. This is not something that I expected to see in my lifetime as an infection doctor, because measles has had eradication status in Canada for many years. And the scale of this outbreak is really massive. Alberta, like many places, is not a single population. There's many populations within a population. And I think that what we're seeing is very under-vaccinated populations are having very high rates of disease, and it's basically network spread. And so it's very hard to contain that. And that's what happened in Ontario as well, I think.
When you're talking about that, of course, in part is the fact that it is such a contagious disease. And so that can also lead to several complications too. So how concerning is that spike and the spread?
Well, we haven't really seen it leveling off. We're seeing continued spread. We're seeing more involvement in the larger cities, Edmonton, Calgary, which have very high vaccination rates. And we know, as you said, that if measles is around and you're vulnerable, there's a 90% attack rate. And so any given exposure can result in many secondary infections. Most people think of measles as a rash illness, but really it's a whole body illness that can have serious consequences for a small number of people, especially kids under 5. And when you multiply a small, incidence of severe outcomes across a very large group of vulnerable people, you do start to see high hospitalization rates and really bad and lifelong effects of measles in, babies and young children especially. And in our adults, we're actually seeing quite a high hospitalization rate as well. It's a severe illness on its own.
Dr. Saxinger, of course, across this country, there's no secret that there have been challenges with healthcare, with resources being stretched. So when you look at something like this, a measles outbreak, and of course, it's quite a learning curve for physicians, because to your point, this isn't something that people would have necessarily been trained on because measles had been eradicated. How have all of these factors sort of come together in terms of the impact on the healthcare system in the province?
The absolute numbers of people hospitalized at any given time is fairly low, but the fallout for the health system is a lot of diversion of resources. You need to have very strict isolation precautions and infection prevention and control investigations to track people who've been exposed and quarantine them. And so there's a tremendous amount of work associated even with a small measles outbreak. And right now there's a lot of restructuring and role clarity issues, and it really is a huge burden already, in addition to people being ill. And we also suspect there's probably more cases uncounted, and I would expect we will start to see more people coming to hospital with measles.
We were talking about the impact of the Calgary Stampede, for example. Do you anticipate that will, perhaps show another spike then, as we'll see what happens, I guess, in the next few weeks?
I think there's a real risk of that because, you think open air should be lesser risk, but measles is very, very transmissible. And there are lots of places where people will be in very close proximity. And it's a mingling of people from different areas, including some very under-vaccinated areas. And so I do expect there will be fallout. And, that does make it harder to control because it becomes impossible to trace after a period of time. And so that's why we have whole zones in our province are basically considered measles exposure risk. And they're not really trying to do specific tracing anymore of people exposed in public places. And so that's a pretty bad sign.